Advantage plans. We're coming up on the annual enrollment period, and a lot of people are going to be reviewing their Medicare Advantage plans. Or they definitely better. There's going to be big changes for 2026. But you see, a lot of these plans, most of these plans out there are zero premium per month. Already got a bunch of questions here. We'll get to the questions as soon as possible here. So let's talk about how Medicare Advantage plans are funded. So these plans, a lot of them are $0 per month. So if they're really zero per month, the government, all those Medicare insurance agents and companies out there that harass you daily and call you all day long and never leave you alone, they can actually lose their license. They're not able to enroll you in Medicare anymore if they say this Medicare Advantage plan is free. Wait a second, if it's zero premium, isn't that free? No, they're not allowed to say that. They cannot say this Medicare Advantage plan by being zero is free, because it's not. And so let's talk about that today. And I'm going to show you that you're probably paying more than $12,000 a year, a lot more than $12,000 a year for your Medicare Advantage plan. And you might not be getting anything in return. And I'm going to show you exactly how to get something out of this. So my name is Ed Weir. I ran the third business Social Security office in the country. Okay, let's break it down and exactly how these Medicare Advantage companies make their money. So they get paid. Guess what? You sign up for whatever Medicare Advantage plan and it's zero premium, and you're like, wow, that's, for me, that's free, right? Well, again, people can't say that. It's zero premium, yes. But you also have a lot of costs with those Medicare Advantage plans. You might have to pay for a specialist. You might have to pay $100, $200, $300 a night for the hospital. You might have to pay a co-insurance or a co-pay, deductibles for your prescriptions, for an MRI, a CT scan, whatever the case may be. So it's kind of a pay-as-you-go type system. The more you use, probably the more you're going to be paying out. So the company keeps all that money that you pay as part of those deductibles and everything like that. But when you enroll in a Medicare Advantage plan, you sign it and you said, okay, this is the plan I'm going to have starting January 1st. That company takes their their begging bowl, I guess, and goes to Washington, D.C. and goes to, I guess, now Dr. Oz at CMS, the Center for Medicare and Medicaid Services, and says, hey, we just signed up Bella or Naomi or Keep Smiling or JJ, some of the people, Tanya, hey, Tanya, and give us money. So that's exactly what they do. And on average, so let's say it's different depending on the county. So some counties that are more expensive in terms of, medical costs, they get more. In rural areas, they get less. But let's say on an average, so you're an average enrollee. So the government gives that Medicare Advantage plan, let's say $1,000 a month. Again, if you're in a higher, it's maybe $1,400, lower area, $800, $900 or so. It's complicated how they do this, and they change it every year. They just increased it from 5% from last year to this year, so it's 5% increase. I don't think we're going to get a 5% COLA, but Medicare Advantage plans got a 5% COLA, a little over 5%. So, well, anyway, I won't go on to that tangent. So PMPM, per member per month. So the company, your Medicare Advantage plan, is getting $1,000 a month to take care of you. And if you're really healthy, then they get less. If you have multiple conditions, this is why these Medicare Advantage plans like to, send you to these wellness visits and stuff like that, because they like to upcode. Well, not necessarily upcode. The upcode is illegal, is where they say, okay, we sent you in, we gave you a Band-Aid, but we're going to charge you for a tourniquet, right? We charged you $100 for a Band-Aid, but we're going to actually bill $1,000. That's kind of upcoding. It's not supposed to do that, but they want to give as many codes as possible to you. The sicker you are, the more money they make. So if you have multiple conditions, they could receive $1,500, $2,000. If you're very sick, they could receive $2,500 a month for the entire year, every single month. And let's say you're an average enrollee, and this year you're healthy-ish, so they're getting $1,000. And then something happens next month, you get sick or you have an accident or something like that, and you get these multiple conditions. Next year, then the CMS, Medicare, the health insurance company report all that, and they said, okay, you were $1,000 last year, but now you're getting kind of sick and stuff, so we're going to up you. So this year we're going to pay the Medicare Advantage plan $1,500, $1,700, or whatever the case may be for your particular situation. So that zero premium is costing us, because where does all this money come from? Yes, doesn't fall out of the tree, it falls out of our wallets. How this whole thing is paid is Part A is paid, you paid that all your life, FICA. So your payroll tax, that 1.45% that you pay out of your Social Security, out of your check, that the FICA part of it goes to Social Security, 6.2%, and the other part goes to Medicare, 1.45%, and then your employer pays the other part of that as well. All that money goes into Part A. So when you go to the hospital, that's where that money comes from. And that money goes to the Medicare Advantage plan. So you have essentially paid this Medicare Advantage plan for decades, and now they're giving you a zero premium, and you're like, oh, wow, these guys are so nice. They're giving me my plan for zero premium. You already paid for that. You paid for that over decades for the Part A. Part B, you're paying the $185. You cannot get a Medicare Advantage plan if you don't have Part A and Part B. In order to get Part B this year, you have to pay $185 a month. That goes to the government, and the government, pays that Medicare Advantage plan. But the $185, just kind of to clear one thing up, for Part B, all of the costs for Part B is not covered by the $185. That covers probably about 25% of total Part B charges throughout the country. Part B covers your doctors, any type of outpatient type stuff. Part A covers the hospitals. That's covered. You paid that for decades. Part B, you're paying that this month, $185. That covers about 25% of the total cost. The other 75% comes from just regular old taxes. So that's how that's paid. And then again, the government gives X amount of money every single month to that Medicare Advantage plan. So you're paying for it. And how do they give those extra benefits? The government in each little county throughout the country, they set like a benchmark. Okay, in this particular county for a regular, enrollee, not really sick or not, super healthy or anything like that, just a regular, about $1,200. It's going to cost about $1,200 to take care of this person's Medicare health issues in this particular county. And the company, the Medicare Advantage company, says, you know what, we can do that for $1,000. So we'll bid $1,000. And the government says, okay, cool. You just saved the American taxpayer $200. Awesome. You guys, we'll put that back and we'll pay off the deficit. Yeah, not so much. They rebate that $200. So the company says, we can do it for $1,000. Government just saved $200. They don't save it. They give it to that company as a rebate, so that company can use it for those extra benefits. So how do you get dental and vision and transportation and stuff like that? Is because the company bid lower and they got the rebate, and they're able to use that money for extra type of benefits that are not traditionally covered by Medicare. That's why if the benchmark is higher in big cities, that's why in big cities, a lot of those extra benefits, the dental, vision, and hearing and stuff, those are a little bit more generous because the benchmark is higher. If you're living out in the country, then sometimes those aren't that great just because the benchmark is a lot lower. So that explains why people get really, really good benefits, extra benefits, and other places don't. Okay, so that's the whole, it's not zero premium. You've already paid for it out of your hard-earned dollars. So that zero premium that these companies are giving you, and you're so happy that they're so awesome and nice, and the CEO is so awesome and nice that they're giving you these plans for free. Zero premium. Excuse me. I didn't say free. I said zero premium. But how do you get that money back? Unlike auto insurance, where, because this is insurance, health insurance. Medicare is health insurance. With car insurance, you pay hundreds of dollars a month forever. And hopefully, knock on wood, you never have to use for it. So when you shuffle off your mortal coil, in 50, 60, 70, 80, 100 years or whatever the case may be, you've probably paid millions of dollars into auto insurance. And if you're super lucky, you'll never get that back because you won't be in a terrible accident. But health insurance, in this particular case, we can get some of that money back. And how do we do that? Well, we take advantage of the programs that are offered. And we kind of double dip a little bit there, and we take advantage of what we already offered, and hopefully we become less sick. These are preventative services. So this is the Medicare and You Handbook for 2026. A lot of people have already said they've already received it. Someone said they really shouldn't send this out in a paper form. It's cost the printing office way too much. And you can actually go in there and you can opt out of the paper one and just get an electronic one like this, which is a good idea. Let's save our taxpayer money. So I'm just going to go through there and just go through it really quickly. And these are the types of preventive services. So if you go into the book and see the little apple next to it, Part B covered services, all of these are covered services. Sometimes you have to be at higher risk or have a family history or something like that. But these Medicare Advantage plans are supposed to offer these preventive services at zero or nominal charges. And it's good for you and keeps you healthy, and it's supposed to be provided. So aneurysm screenings, we've got alcohol misuse screenings. Let's see, bone mass measurements, cardiovascular behavioral disease screenings, cervical cancer screenings, colonoscopies, definitely get one of those. Tobacco-caused disease, depression screening, diabetes self-management. Let's see what's flu shots, glaucoma screenings, definitely get one of those. Hepatitis B shots, infection screenings, HIV screenings, lung cancer screenings, definitely get one of those. Mammograms, definitely. This is stuff you've already paid for. It's like you've ordered this on Amazon. You ordered mammograms and colonoscopies on Amazon 20 or 30 years ago, and you paid for it 20 or 30 years ago, let's say, and you're waiting for your order. If you ordered something on Amazon a couple of days ago and it doesn't come in, and you would not be happy. You would be very angry. You paid for it. How come you're not getting it? This is that. You paid for this stuff. You've ordered this stuff. You paid for it. Pick it up, please. Medical nutrition therapy services, diabetes prevention, obesity behavioral therapy. What else we got there? Flu shots, HIV prevention, prostate cancer screenings, STI screenings and counseling. I skipped one there. Let's see. Shots, other flu shots, hepatitis, all the rest of it. Medicare preventive services. These are not your traditional, physical exam type thing where they run blood tests and stuff like that. It's kind of a welcome to Medicare, so they're not the full thing. But the doctor, if they ask you a bunch of questions and they say, oh, you might be an issue for high cholesterol, then they can give you a blood test, and it's usually not. You might have to pay a little co-insurance or something like that, but that's definitely recommended. And the yearly wellness visit, same type of situation. It's not a full physical. Many people that I'm sure have gotten it realize that, hey, wait a second, I went in there for a physical, but they only asked me a bunch of questions. And so it's not really a full physical. But anyway, so that's how this is how you have made the sausage. We as American people have made the sausage. We are paying these companies every single month. So every single month, you are essentially get out your checkbook and write a check to your particular Medicare Advantage plan and write it out for $1,000, and then look at it for a while and say, okay, I paid my Medicare Advantage plan $1,000 this month. I'm going to go get something and rip up that check, obviously, and throw in the trash. But that might be a good idea. And those extra benefits, if you've got dental, vision, hearing, transportation, make sure you use that. That stuff disappears. Your Medicare Advantage plan ends at the end of the year. And if you don't do anything, then that particular plan that you have will automatically, re-up. you will be re-enrolled in that plan if that plan still exists. If you have a PPO, about 1 million of those are going away. But the key is to make sure you're in the best plan every single year. If you're in a Medicare Advantage plan, if you're in a Medicare supplement plan, they don't change, the Plan N or the Plan G. But Medicare Advantage plans, Part D prescription drug plans, they change every year. If you don't do anything, they automatically keep you in the same plan. But remember, people say, "Well, I like this company." Okay, fine, keep that company. But I almost guarantee 99% of the time, in your particular area, that company you have has 2, 3, 4, 5 different plans. And they might have a new plan for 2026 that, a new model, new shiny model. You got the old model. Upgrade to the new model. So check. How do you check? Doesn't matter who you contact. Have your plan. That way you know what you have and what you currently compare to. Your providers, your physician, your clinic, your hospital, which ones you want to definitely keep. Your prescriptions, you have the dosage, you have the name, you have, how many, you take a day and stuff like that. You know how much you're going to be charged. If you want to keep a pharmacy, you have the name of that pharmacy. You have your priorities. Do you need more dental? Do you need to save money on prescriptions? Do you have to keep a particular doctor? And this time, have a little patience. If you can't get in with your Medicare agent that usually helps you on October 15th, don't worry about it. You have until December 7th. So you have a little bit of time to do that, and your new plan won't start until January 1st. And if you need help, you can reach out to our partners there at Chapter. They can definitely help you out as well.